I'm Dr. Brett Gilbert, board certified endodontist, and I've been doing endo for over 20 years, and I love getting out and exploring what's new in the marketplace, and I wanted to bring that information to you. So let's get busy discovering together and explore what new products are out there. This episode is all about the Calaject computer-assisted local anesthetic device. This is manufactured by a company called Ronvig in Denmark. This is a unit that I've been using for several years that has literally transformed my practice from both the perspective of me and the comfort of my body, as well as for my patients and the really incredible ability to give painless injections. So the idea here is that this unit allows you to control the speed of flow of the anesthetic solution in a way in which the patients really have minimal, if any, discomfort at all. I find that patients are very excited about this technology. I think it's a great practice builder because so many patients fear the needle. They fear the local anesthesia, and this really is a solution for that, while allowing the doctor to maintain an incredible ergonomic position that is so kind on the body that it really takes away what I would describe as one of my greatest pain points in my whole procedure, which was giving local anesthetic injections with a manual syringe. So let me show you some of the functionality of it. Okay, so the Calaject has this very compact base, and this is going to be your control unit. It has several different features on it. Obviously a power button and a reverse button, which I'll explain in just a few minutes. But it has three different settings, 1, 2, and 3. One is specifically designed for PDL type injections. I sometimes use it for intrapulpal injections as well. It's going to be a very slow rate of flow, and it's incredible for PDL to not have to put so much tension on your hands and fingers to establish that anesthesia. The second functionality is for local infiltrations. This one will start out with a very slow flow, giving you almost like a pre-numbing effect before it increases its speed of flow and continues at that rate until the anesthetic carpule is complete. And then lastly, the number 3 is going to be for regional block anesthesia. What's nice about this is you have complete control of the speed based on a few taps on the foot pedal. So what this unit allows you to do is control the speed of flow and what you're doing with the foot pedal as opposed to using your thumb and your hand. Now, it has this incredible wand. The wand is very well weighted, and this wand has this base here, as you can see, which holds it in place. So this barrel is autoclavable and can be used over and over again. We use them many, many times. They're very durable. And then, of course, you can attach your needle tip, which would be disposable, right to it. So you do a little twist here, and just like you're accustomed to on a regular syringe, it screws right in. Then you take your solutions, whatever carpule is appropriate for the patient, whatever you like to use, and this goes into and attaches to the wand. So once this is in position, what you'll find as the clinician is it's so nice to be able to use a pen grip. A pen grip gives you a lot of flexibility as you're bringing this into the tissue, including, as you can see, a bidirectional ability to do a little turn. And I find that when you pull the tissue over and you give a little turn, the patients literally do not feel it, to the point that they're constantly asking me if I used a needle, which is the greatest feeling as a dentist, to have your patient ask if you've used a needle when you have. So what happens with this, the way that it works, is it powers on, and it has a plunger that will come up and slowly push out the solution at just the right rate. The key with Calaject is the rate of flow. This unit calibrates that rate so it's ideal for the tissue to accept it. Now, when we start on the first level, this is again going to be mostly for PDL injections, and ultimately some dentists find that for restorative they can use this to just do single tooth anesthesia. So this is going to be a very slow rate of flow. So ultimately it's going to be dripping slowly, and ultimately this does have, after 5 seconds, the ability to autoflow. So it'll take close to 3 minutes at this rate to empty this carpule, so you can actually lift your foot off and it will continue to work. Next, I'm going to select level 2. This is going to be used for local infiltration. So with this, you're going to get a slow rate of flow initially, and then after 10 seconds, it will actually start to increase. Now, the display here has a little green dot that's going to beep, but it'll start to beep and then it'll go faster and faster, both audibly and visually, to let you know that you're now in the higher rate of flow, which you can see is considerably different from the dripping action in the beginning. So again, this is in essence a pre-numbing leading up into a greater rate of flow. Then I'm going to select the number 3 level. So this is going to be more for mandibular blocks or regional anesthesia. So in this case, I have full control. So I can start out and it will always start in default at the slower speed. But with a quick double tap of the foot pedal, I can actually increase that speed significantly. And then I can double tap again and go back to the slower speed. So in this one, you have a lot more freedom of speed that you can control. Now what's really, really important about Calaject is when I let off of the foot pedal, it has an aspiration action. So just like with a manual syringe when you pull back, this gives you the ability to aspirate and determine if you are in a vessel. So the Calaject has really thought of everything. Most importantly, as the clinician though, I find that being able to use a pen grip like this gives you so much more comfort, and ultimately, once I've injected into the patient's tissues, I can literally bring my left hand down, I can sit very, very comfortably, and I have the ability to give this anesthesia with complete comfort for the patient, but also for complete comfort of my body. And I found that over the years, my left shoulder was so sore from giving injections and having my arm up in the air, trying to make it more comfortable for the patient, that I started to develop a lot of shoulder issues. And Calaject was actually the answer for me. I purchased this for the specific need that I had to be in a more ergonomic position when giving local anesthesia, and it has absolutely fulfilled that. And I've been using it every day. It's the only anesthesia injection I'll give, and I've been doing that for the last 4 years. Okay, so we're here in the clinical simulation setting to show you Calaject. So again, I've loaded in a new carpule, and what I'm going to do is I'm going to actually tap on the foot pedal, which will prime the system, and now it's ready to go. You could hear a little audible there. So now what I'm going to do is now I have the ability to use a pen grip. So I can actually hold this, I can rotate this. It's much more comfortable than anything I've used before. Coming at it with a manual syringe, it's much more difficult to control the end. But here with this pen grip, I have an incredible ability to hold it very comfortably. Now what I like to do is I like to come in and I'll go ahead and I'll sort of get my finger up into the vestibule, and I like to do a little rubbing and shaking on the cheek. Now as I bring the tissue over the needle tip, I'm going to give it just a slight turn. And the combination of bringing the tissue over the needle with the slight turn seems to be really the magical combination to keep patients very, very comfortable during this injection. So I'm going to come in here, I'm going to get my alignment, and I'm going to go ahead and I'm going to pull the cheek over the needle, and I'm going to just give it a little turn like so. And now I can literally drop my left hand, and I can just sit here very, very comfortably and watch as the plunger works its way down into the carpule and pushes out the local anesthetic solution. So I'm going ahead, I'm on the second infiltration setting. It's going to start slow, and now it's already going into the faster rhythm, which you can see very clearly by the blinking light over here on the base unit. So you can see as it pushes through, if I want to aspirate, I simply lift my foot up, it pulls back, and then I can continue on. Now in the second setting, once I let my foot off the pedal and I push back on, it will start slow again. Again, it's a 10-second slow phase followed by the more rapid phase of dispersion of the solution. And I'm going to go ahead and let this run, and then ultimately once it's complete, we'll be able to backtrack this plunger and we would be able to reload if another injection is needed. Now I can always come back in and do a little rubbing and shaking if necessary, but the beauty is that my left arm is down on my armrest. I'm sitting in a very good position. The patient's comfortable, I'm comfortable, and this is a real departure from using the manual syringe, being locked into position, and then having to use my thumb to push it through. So that's going to be the local infiltration. So in this simulation, I'm going to use the #1 setting, which is going to be essentially for a PDL injection. So this is going to be a great opportunity to really get the tooth numb in a single fashion through the cribriform plate through the PDL. This short gauge 30 needle is also really nice for palatal injections. And I always use the #1 setting for my palatal injections as well because it's so slow that it's much more comfortable for the patients. So let's first start with that palatal injection. So in this case, we're going to find where that greater palatine nerve is, and you can use a little distraction with your finger, or you can just give that little rotation again, which is really critical. And I'm going to go ahead and I'm going to start the dispensing of the solution. And what it has in this #1 setting is it also has an auto flow. So after 5 seconds, I'm able to let my foot off the pedal and be able to have it auto flow. Once I touch the pedal again, it will stop. But if you don't prefer the auto flow, you can just continue to leave your foot on the pedal. And again, this is going to be the palatal injection. Now when I'm doing a periodontal ligament or PDL injection, I really want to have a distinction where I want the bevel of the needle to be facing the bone, not the tooth. So I'm going to take a look at where the bevel is, and I like to give just a little bend on the needle like so. And then what I'm going to do is I'm going to come in here and I'm going to find the line angle, and I'm just going to tease it underneath like so. Now when I activate the foot pedal, there's going to be a pressure sensitivity to this, which is going to cause the pressure bar to start to increase. So I am looking at that pressure bar as I'm giving PDLs, number one, to ensure that it's getting in there effectively, because if there's no back of pressure, then there's not going to be really a PDL effect. But also it's going to give me an opportunity to realize that if it gets too pressurized, meaning the plunger is having too hard of a time pushing, then it's actually going to shut the unit down and shut it off. So there is a safety feature with these PDL injections. So again, this is the one setting. This is going to be a slower drip meant for the PDL. I sometimes also use it for intrapulpals, but PDL and palatal injections mainly. Okay, and the last simulation is going to be for an inferior alveolar nerve block. So again, I have my longer needle here. I've primed it by pressing on the foot pedal, and it pushes out any air in the syringe. Now I'm ready to go. So for the inferior alveolar nerve block, I always like to do a little finger waggle here to just kind of numb and distract the patient here. So when I do, I'm going to bring this in. I'm going to, again, bring this into position. And then ultimately, once I'm there, I can just bring my left hand back down onto my armrest. Very, very comfortable. Now remember, when I let off of the foot pedal, it aspirates. So I can see whether or not I'm in any type of vessel and then reactivate the foot pedal. Now in the number 3 setting for these types of nerve blocks, I have the ability to change the speed with a tap of the foot pedal. So a quick double tap will allow me to get into the higher speed, and you'll see that audibly, you can hear that, but also with the light it will blink faster. So I'm going to go ahead and have this opportunity to be able to do this injection safely, be able to do it comfortably for me and for my patient, and always have the ability to aspirate. Now in this setting, number 3 versus number 2, when I let go of the foot pedal and go back on, it does not change the speed. I can continue in that faster rate of flow. I hope you've enjoyed learning more about the Calaject computer-assisted local anesthetic system. This is a device from Ronvig and Directa Dental that I've been using in my clinical practice for 4 years. I find that it really helps with my body being comfortable, my ergonomics, and my patients just simply love it. So it is a product that I give my seal of approval, meaning that I have used it in my clinical practice, I have vetted it, and I recommend it for any dentist who's giving local anesthesia. I believe it's a great practice builder to be able to provide new technology for local anesthetic, the thing that patients are most fearful of. So I hope you enjoyed this video. If so, please like it and subscribe to my channel. Also, leave any comments or questions below. I would love to hear from you. I would love to interact with you. And if you have any products that you'd like me to review, please let me know. Leave a comment and I'll get back to you. So thank you for watching the video and have an awesome day.